My name is Francesca Dominici. I'm a professor of biostatistics, data science, and population health at the Harvard THN School of Public Health and a co-director of the Harvard Data Science Initiative. My expertise is on analyzing massive amount of data and millions of electronic medical records to better understand the short and long-term impact on health associated with exposure to air pollution and especially to wildfire exposure. The sky is orange because of a very high level of fine particulate matter. Unfortunately, right now, the level of fine particulate matter in the air in the Northeast is extremely high. So the most important thing to stay safe is try to limit outdoor exposure to air pollution as much as possible. And a way to do that is to stay indoor. Close your windows, activate air conditioning. If you have an air purifier, activate the air purifier. If you really have to go outside, just wear a K99 mask. Our study have shown that there are both short-term and long-term consequences of breathing high level of fine particulate matter. We do know that being exposed to high level fine particulate matter can increase your risk of hospital admission, either for cardiovascular or respiratory disease on the same day, on the day after, up to 2 or 3 weeks after. We also know that the long-term exposure of fine particulate matter also has chronic effect. We can see with our naked eyes that wildfire smoke can travel very far. We have been, the general public sometimes have been thinking that you just have to be careful if the wildfire is occurring across the street from you. But we are seeing now with satellite images that wildfire smoke, right now we're seeing a higher level in New York that has been originated from Canada. And indeed, we also are experiencing high level of fine particulate matter in the East Coast when there were wildfires in the West Coast. So bottom line, wildfire smoke can travel really far, and what is important is not much where it's coming from, but the level of fine particulate matter that you are breathing right now. Unfortunately, yes. Our studies have demonstrated that by using atmospheric chemistry model that even with moderate to aggressive climate change regulation in terms of targeting greenhouse gases, we are going to see a higher occurrence of wildfires, both having more common but also more intense. There is a website called Air Now, and you can log in and you can see the level of fine particulate matter in your area by zip code. Also, there is an air quality index on your phone that you can check on a regular basis. These are very this is very reliable data. The symptom that we are experiencing is burning eyes. We start coughing. We feel like similar symptoms as a sore throat. And then for most severe, we may experience the classical symptom of an heart failure or a myocardial infarction. Well, first of all, they should limit the exposure as much as possible. Stay indoor, close windows, run an air purifier. I also think that they should call their doctors as to see whether or not there is anything from any preventative measure that they can take. Now we know that this high level of fine particulate matter are going to persist for a few days as a result of the wildfire in Canada. Whether or not that's going to occur again and how long, it will really depends on whether or not there will be more wildfires. Okay.
Okay, stupid question, but the window, it should stay closed, right? Because of the smoke. So then I just breathe this air in here. And then but this air came from, where did this air, how does air work?
So he's right. The air that we breathe indoor comes from outdoor, and so if there are a high level of fine particulate matter outdoor and comes indoor and we close the window, we also have a high level of fine particulate matter. What we recommended, in addition to close the window, to also activate an air purifier, so we then clean the air from fine particulate matter that is indoor.